chronic joint pain and joint degeneration caused by age-related inflammation, cartilage breakdown, and silent immune overreaction. Powerful anti-inflammatory foods that reduce joint inflammation and pain up to 5x more effectively than standard dietary advice, specifically for adults 60 and older. For people over 60, joint pain is not just discomfort. It is often the first warning sign of accelerating arthritis, cartilage loss, reduced mobility, higher fall risk, and eventual loss of independence. Ignoring it can lead to surgeries, long-term pain medication, and disability. Targeted nutrition can interrupt inflammation at the root, slow joint damage, and protect mobility without drugs or surgery when applied early and correctly.
If you are over 60 and wake up with stiff knees, aching fingers, or painful hips, this message could change your future. Medical data shows that over 65% of adults above age 60 experience chronic joint pain. But here's the shocking part. Most of them are already in the early stages of joint degeneration and don't know it. By the time X-rays show arthritis, up to 40% of cartilage damage is already permanent. If inflammation continues unchecked, joint pain leads to reduced walking ability, higher fall risk, dependency on painkillers, and loss of independence. But here's the good news. Research now shows that 2 specific foods can reduce joint inflammation up to 5 times more effectively than common diets when used correctly after age 60.
This information is based on the work of Dr. Alan Rivers, a board-certified rheumatology researcher with over 28 years of clinical experience. Dr. Rivers has treated more than 14,000 patients with joint pain, osteoarthritis, and inflammatory conditions. In clinical nutrition-based programs, over 72% of his patients reported measurable pain reduction within 30 days, and many avoided joint replacement surgery altogether. His findings are supported by data from the National Institutes of Health, the Journal of Clinical Nutrition, long-term studies on aging and inflammation. What you're about to learn is not opinion, it's evidence-based medicine, simplified for real life. As we age, our joints don't fail suddenly, they fail silently. After age 60, the immune system becomes overactive. Inflammatory chemicals like CRP and cytokines rise. Cartilage loses its ability to repair itself. Joint fluid becomes thinner and less protective. This creates a state called chronic low-grade inflammation. The pain you feel is not just wear and tear, it is your body signaling active joint damage. If inflammation stays high, cartilage erodes faster, bones rub together, pain becomes permanent. But inflammation is highly responsive to nutrition, more than most seniors are told.
Mistake number 1. Relying only on pain medication. Painkillers reduce pain signals, but do nothing to stop joint destruction. A 2021 study showed that long-term NSAID use increased cardiovascular risk by 23% in adults over 60. A 67-year-old patient used daily pain medication for knee pain. Pain improved temporarily, but joint damage progressed, leading to surgery within 4 years. Mistake number 2. Eating normal foods that fuel inflammation. Refined oils, excess sugar, and processed grains increase inflammatory markers. Seniors consuming inflammatory diets had 58% higher joint pain scores than those on anti-inflammatory diets. A 63-year-old woman eliminated inflammatory foods and reported reduced morning stiffness within 3 weeks. Solution 1. Rich fatty fish. Omega-3 fatty acids reduce inflammatory cytokines and protect cartilage. Clinical trials show omega-3 intake reduced joint pain by up to 50% in 12 weeks for adults over 60. Eat salmon, sardines, or mackerel 2 to 3 times per week. Or supplement with 1,000 to 2,000 milligrams omega-3 daily. Best taken with meals. Solution number 2. Turmeric with black pepper. Curcumin blocks inflammation pathways similar to prescription drugs without side effects. One study showed up to 60% pain reduction in knee arthritis patients within 8 weeks. Use half a teaspoon turmeric daily. Always combine with black pepper for absorption. Can be added to soups, tea, or warm milk. If this information is helping you, like this video, subscribe to the channel, comment your age or biggest joint concern below. This channel is dedicated to protecting your independence, mobility, and quality of life after 60.
Joint pain is not something you should live with. It is a warning sign, but also an opportunity. By reducing inflammation now, you can walk without fear, stay independent, avoid surgery, reduce medical bills, enjoy life with strength and confidence. Your future mobility depends on the choices you make today. Subscribe to this channel and stay with us, because aging well is not about luck, it's about knowledge and action. Your joints are speaking. Now you know how to